Welcome to the Ordinary Doula Podcast with Angie Rozier, hosted by Birth Learning, where we help prepare folks for labor and birth with expertise coming from 20 years of experience in a busy doula practice, helping thousands of people prepare for labor, providing essential knowledge and tools for positive and empowering birth experiences.
So welcome to the Ordinary Doula Podcast. My name is Angie Rozier. I'm your host, and we are sponsored by Birth Learning. And we have a very awesome guest with us today. Her name is Dr. Katie Taylor. She lives and works in Winston-Salem, North Carolina. She's one of my favorite practitioners to refer folks to. And I have totally enjoyed my interactions and what I've learned from her over the years as well about pelvic floor physical therapy. So Katie, can you give us a little introduction about yourself and some background?
Thank you. I'm so excited to be on your podcast and chat with all the mamas. As she said, name is Dr. Katie Taylor. I am a pelvic floor physical therapist. I own Taylor Physical Therapy and Wellness, which is a holistic women's health practice in North Carolina. So I think you said a little bit about myself to start with.
Yes, please.
In this profession, I started this practice in 2020 as I guess you could say, product of COVID, because I had recently moved back to this area literally the week North Carolina shut down, and was supposed to start up a women's health practice with another group in town. But with young children said, nope, that's not going to happen. And ended up staying at home for, probably 6 months with our kids. And that time just really, I say, out of a lot of Jesus and wine, discerned that there was a big need in this area for women's health. And so I began in November of 2020 with what I call my little tissue box room with just me, thinking I might have just a few people come and see me. And then we've really flourished and have multiple clinicians, and just recently purchased our building and moved in September. And so we've got a lot of different things that we offer. And so, yeah, I'm really passionate about helping women in lots of different life stages. And so today we'll dive into certainly the perinatal specifics of what we do and why it's important, and every woman needs it.
Cool. Very cool. I love what you're doing. And what awesome growth in just a little bit of time.
Wild how God does things in your life, right? I mean,
so
I was
true.
like blown away. I still am. I'm like, oh my goodness, it's only been 3 years and look where we are.
Yeah, that's awesome. I love it. So tell us a little bit about, for those who may not know, what pelvic floor physical therapy, why it's good during pregnancy.
Yeah. So I will start by just briefly chatting about what the pelvic floor is, because I think that's gotten a lot more trendy in the last 5 to 10 years, and it's a lot more on social media. And so women are like curious and learning more about what we have. So our pelvis is basically got this little bowl of muscles in the base of our body, right in the middle, from our pubic bone back to our tailbone. And it's like a little hammock that supports our uterus, our bladder, and our rectum. And so that is what's referred to when we hear pelvic floor. And so pelvic floor therapy is a specialization, it's a little niche within physical therapy that really works on addressing issues surrounding that part of our body. And so we think of it as bladder health, bowel health, sexual health. They're sort of big buckets of function that falls into. But pelvic floor therapies, as an example, I'll touch on what our practice sees. We see women only. We're specific for women's health, but that can be a wide range of things across the lifespan. So bladder health being one of those things I just mentioned. So we see incontinence, urinary urgency, frequency, recurring urinary tract infections. We see bladder prolapse in the context of pregnancy and postpartum. This is a very, very common issue that women can develop, or if they had it existing, because it can happen outside of pregnancy, that can often be exacerbated. And so really emphasizing that, yes, this is a really common symptom that women can have, but very much not normal, and very much things that we can do to help with that. With regards to bowel health, constipation, IBS, hemorrhoids, incomplete emptying. We see a lot of women that have bowel dysfunction, also something that we see a lot of during pregnancy and postpartum. We have now data that tells us that 70+% of women experience constipation at some point during their pregnancy and into postpartum, often a product of our iron in our prenatal supplements. Bowel changes can happen in that lifespan very commonly as well, but also we like to say not normal, lots that we can do to help that. And then sexual dysfunction is something that we often will see as well. Women can have painful intimacy is a very, very common thing women can experience, again, outside of the context of pregnancy. And that is a product often of perineal scar tissue, tension in the pelvic floor muscles, vaginal dryness and atrophy that can happen in the context of postpartum, especially if we're breastfeeding, in the context of menopause. And so we really love to help women get to a space where they feel happy and satisfied in whatever that looks like for them sexually. But just knowing that it's not normal for sex to hurt. And unfortunately, women are often told, just use lubricant, just drink more wine, whatever it is from their poor medical advice they're getting or reading online.
Right.
And so, yeah, those are, I would say, 3 big buckets of things that we treat when it comes to the bladder, bowel, sexual piece. But we often will see women in terms of just pain. So a lot of pelvic pain will be common with things like endometriosis, interstitial cystitis, a condition called vaginismus. There's another condition known as vulvodynia, and even orthopedic things like tailbone pain, hip pain, low back pain. These muscles attach there and are often the root cause of why women have those orthopedically seeming pain. And so it's really important when we have patients with those symptoms and complaints that we're really looking at pelvic alignment. We're looking at hip strength and glute strength and posture and really the entire body and not just the pelvis. Yeah.
Very cool. So you can get pretty specific with that, addresses other issues as well.
Right. Yeah.
Okay.
And,
very cool.
Most women, out of everything that I just talked about, most women that have a form of pelvic floor dysfunction have pain in one other area of their body. So we see a lot of women that have a chief complaint of something pelvic floor related, like incontinence or painful sex or constipation. And they have an issue with their feet, or they have jaw and neck pain. And so we really see that women that experience pelvic floor issues often really have issues in other areas of their body as well.
Okay. And you can address those. So excellent.
Yes.
Okay.
Yeah.
Cool. So tell me, and do you have a sense of, I totally have noticed what you said, that this is picking up some steam and some popularity, pelvic floor PT, over the last few years, but how many people know about it? Like,
Right.
do you get most people before? Do you get a lot of people after when they're like, oh, wow, I need some help? Or like, tell me how are
Great
people aware of
question.
this?
Yeah, so unfortunately, I don't think it's mainstream that most women, if they know about it, it's because they might have seen 1 or 2 videos on their social media, but they certainly haven't personally been to a pelvic floor provider. Most women that are in our office have had issues for a while and have been to multiple providers, or they've just had their symptoms for a long time before they finally will have searched enough online and found us, or they have had a girlfriend that's been, and their friends are like, you've got to try this. And for me, it can be really frustrating because women will have, suffered with their issues for quite some time before they end up in our clinic. And then we can really provide effective relief in a pretty short amount of time. And they're like pulling their hair out, like, why wasn't I told about this? Or why didn't I get here sooner? And so to us, it seems quite obvious,
Mm-hmm.
but unfortunately it's not a mainstream thing. I think physicians often just don't understand what we do, or women are just, they've had this reading online or telling, oh, just do Kegels and that's the answer. And that's just so not what they need to be doing. And so I would say that's a long way of saying, no, it still is not mainstream.
Okay, so there's a lot of work to do for awareness, really. Help people
Right,
be aware.
right. Yeah.
So if people are aware, which would be ideal, when during a pregnancy, if they're preparing for labor, for birth, whether it's their first baby or their third or fourth, when is an ideal time to get some care?
Yeah, great question. So, if women have existing symptoms, so you find out you're pregnant and you know you already leak when you jump or leak when you sneeze, you already are constipated or already have, again, some form of pain issue, I would say right away, the sooner that we can be addressing these things. And honestly, even backing up prior to that, if we can have someone come in pre-pregnancy, conception, even we'll see women during their infertility treatments,
Mm,
addressing existing issues is key, and doing that sooner than later really helps us to better manage that and give us more time to shift into a birth preparation focus and mindset versus like addressing an existing issue. We've seen women as soon as they find out that they're pregnant, because they for example, relaxin, the hormone relaxin has its first peak at 9 weeks during pregnancy. And so women will often start to develop pelvic pain, pubic symphysis dysfunction, for example, really early in pregnancy. And while we don't do internal treatment that early, we have a lot of things that we can do externally, pelvic alignment, core things, stabilization to really address that. Secondly, if we're not having any issues, we don't have current symptoms, we are purely wanting birth preparation, being proactive, etc., then 20 weeks is where our pregnancy prep program starts at our clinic. So we have time to get to know the mom, what her birth plan is, go through a lot of labor and delivery education, and help prepare her still.
okay. And tell me if you start at 20 weeks with someone, how many visits might they be looking at until they get to 40 weeks?
Yeah.
Like what's ideal? And maybe it's different for every person, but
Yeah, exactly. So if we have that, again, no symptoms, just
regular pregnancy.
like regular pregnancy stuff. So our pregnancy prep program would be kind of what that I would say would be modeled after, and that's 3 visits.
Okay.
And so it's typically 20 weeks, 30 weeks, and then again, once we're term at 36, 37 weeks. That's a time where we first visit, get to know your medical history, your birth plans, and your body. So getting a good assessment. Visit 2 is diving into all of the things of labor and delivery and breathing and pushing positions, etc. And then visit 3 is a early postpartum sort of check-in, where we go from the minute you have baby until 6 weeks when you come back to see me. This is what we're doing. And so that is something that we will have 3 visits. If we have someone come in and they very commonly are having like a lot of sciatic nerve pain or a lot of pubic symphysis pain, or we're having a lot of incontinence, then we start visits weekly to really make sure we can nip those symptoms in the bud, get those resolved, and then we'll taper down as we're able to. So I would give that a big, it depends.
Yep, absolutely. Every case is a little different. So tell me, what does a visit look like? If we're doing 3 or if we're doing more when needed, what can folks expect when they come? I think, and the clients I have talked to, they are kind of nervous about this. They're like,
Yeah.
okay, pelvic floor PT, like, what are we doing? What's expected in a visit? What can I anticipate? So tell us a little bit
Yeah.
about what a visit might look like.
Yeah, totally. It is. It's a very intimate part of our bodies, and it's something that can be very vulnerable for women and very intimidating, especially if we've had any type of trauma before and we are just very nervous about that, or if we've had a poor OB/GYN experience or a birth trauma. And just the idea of having anyone look, assess, treat your pelvis is just really anxiety producing. I think that it's important for women to find a provider that they really feel they can be relaxed and vulnerable with, and they jive with. So that's, I think, a big thing first. And if you don't, spoiler alert, there's more people out there.
Keep hunting.
But yeah, when you come in at our clinic, you're going to sit down with your provider one-on-one. Our treatment rooms are very not medical, so they can feel a little bit calmer and relaxed. So we have time to just talk first and addressing like whatever they want to tell us that day, whatever symptoms they're having. And then we talk about, okay, well, what are we comfortable doing? And so that for me, I usually am getting out my pelvic model, talking about what the pelvic floor is, and we really want to make sure we can understand the ways to look at it. So I always say first is just visually, I want to look at your belly. I want to look at your pelvic alignment. If we're comfortable with the pelvic floor, then I want to look and see what your vulva looks like, what your urethra looks like, what your perineum looks like, and just what the tissue quality is there. And then we can look at things externally. So everything I'm talking about is just with my hand, finger, no speculum, no equipment. I'm on the table with you. You're not up in stirrups or anything that's kind of intimidating, like, again, a pap smear, for example. And they're muscles, just like anywhere else in our body. Even though this is obviously a very vulnerable place of our body, this is just like you might get a neck rub if you had like a knot in your neck. And so I'm assessing how the muscle feels, how it moves, if I feel it has good mobility, if it's sensitive for the patient. And we just go muscle by muscle. We're talking the whole time, seeing how we're doing, checking in. Are we comfortable still? And that's the second piece. And then internally, we can treat and assess intravaginally, or interrectally. Most of the time, if we feel like we're having pelvic floor issues, like I've chatted about, any kind of specific symptom, having the ability to assess vaginally is really going to give me the most clear picture of what's going on. I relate it to sort of a mechanic that tries to identify what's wrong with the car without actually opening the hood. We can get some of it, right, by listening, looking on the maybe inside of the car, but not under the hood, if you will. And so also just with my finger, we have 3 layers of pelvic floor muscles. So that allows me to look at all 3 layers, how they function, how coordinated we are if we do a pelvic floor contraction or relaxing, which for birth is super important, to be able to relax your pelvic floor. And then based on that, that would all happen, earlier on in our time together. Once we assess that, then in a treatment, it's very similar. If we feel like we have tension or scar tissue that we're working on, we do very gentle release work externally or internally. There's always breath work. There's always some lifestyle things like bladder retraining, bowel retraining. I call them mom minutes to help us regulate our nervous system, like whatever it is I'm having you do at home. We're talking about that in our visits, and we have a really clear definition at the end of our visits. I call it the wrap up with our patients, but like, here's what we did today. Here's what I need you to do at home over the next week until I see you again. This is what we're going to do at your next visit. So there's always a really clear, like, okay, this is my plan. This is what we're doing. This is where I'm at in my plan. And so we can kind of move forward.
So people go home with a little bit of homework oftentimes, something to do. Okay. Which could address a lot of different avenues of health.
Yeah.
Okay.
Yeah.
Okay. Excellent.
But it's definitely not, I think it's important too, because we're all busy people, right? Especially in the context of motherhood. So my homework, like I just had a patient, I gave her literally, I mentioned this, but mom minutes. I told her, I was like, every day, 5 minutes a day, I want you to schedule it like it's an important corporate meeting that it cannot be negotiated. Other times it has to happen. You're going to drink your coffee on your porch by yourself without your husband or your kids. And that helps you to lower your stress levels, which will help you regulate your nervous system, which will help you to have better bowel health, which will help you to have less pelvic floor tension. And,
there's a holistic approach, right?
Right. It's a homework, can imply, I think people who've been to traditional PT or whatever, like, oh, here's your handout of 20 exercises to do.
Right.
Not like that.
Awesome. I love that. And it's a lot of self-care comes in, which is, sometimes women, especially busy pregnant people, don't do that very well. So very cool. Okay. So that's some before visits. And 3 could be ideal, again, depending on what people are presenting with, right? What challenges and things they might be presenting with. And then tell me a little bit about, because oftentimes, and as I've sent people to you, I love the results that they get. But afterwards, let's say somebody gives birth, they have a baby, and as I've worked with clients, they realize after delivery that they have a challenge, depending on how pushing has gone, if there's tissue separation, any tearing and recovery there. I had just a couple of these recently, some 3B tears that are pretty significant, even with amazing deliveries, perfect births, like what I would think was a great delivery position. And what I'm seeing more too, and maybe you're sensing this in your area, that providers, and I'm talking more midwives probably, are sending people, they're recommending like, okay, you need to go see a pelvic floor specialist. So tell me after delivery, what can that look like? And you did mention 6 weeks, like when people don't come in the next week after delivery, right? Tell us a little bit about what visits post delivery might look like and what you address there.
Yeah, great question. So postpartum, women can see us again at any time. So we tell moms that if we need to I've had women actually literally come to our clinic like on their way home from the hospital if they're having
Wow. So it can be that early.
Yeah, again, we don't
Okay.
do intravaginal treatment because
Right.
your cervix is still open and that would be risky for infection, but we definitely have a lot of options. If you're hurting so bad, you can't sit to nurse your newborn, like that's just not okay. And we need to be able
And
to
I hear
offer
that a lot. A lot of people like my tailbone hurts,
yeah,
sitting is
right.
painful. So yeah.
Yes. So lots and lots that we can do to kind of help at any stage, but traditionally we will schedule a 6-week postpartum before they deliver. And then actually a 2-week and a 6-week, and just that 2-week visit kind of a just in case we're having lots of issues, but otherwise let's see you at 6 weeks. And then that is where we dive into the birth. I want to know how long you were pushing, what position that you were pushing in, what, if any, tearing did we have? Did we have any birth trauma? Did things go as planned, or did we have to have an emergency cesarean or things like that? And then really diving into, okay, well, what are your goals? Like, what are your wanting to get back to? Because if you are like family walks are my jam, or if you are wanting to get back to marathon running, that's going to look very different than for what I have as our part of our plan. And then really we cover women. So ACOG, or the American College of Obstetrics and Gynecologists, updated their guidelines a few years ago to say, shocker to all of us, care should be more than just a 6-week visit. It should be ongoing care. It should include pelvic health. It should, all the things. So our postpartum recovery program is 4 visits that we have for women at 6 weeks, and then 3, 6, and 12 months. So we really can cover women throughout the entire first year, making sure that their pelvic floor, their scar tissue, their diastasis and their abdomen is healing, that they're back to the activity they love, and really truly should be fully physically healed by the time that they get to a year comparative to their pre-pregnancy state.
Okay, I love that. And I think a lot of people don't realize how long that may take. And I think some people wait a long time until things are quite challenging before they'll address some of those issues.
Yeah.
So maybe, do you see people at like 8, 9, 10 months postpartum?
Oh, yeah.
And they're like, hey, I have a problem and I'm finally ready to look at it.
Exactly. Yeah. It's again, one of those things that even though it's like the national guidelines now, I am here to tell you that hardly any OBs
yes, it
are
takes a
sending
while,
their
right?
people to us. So it really, unfortunately, it's either women finding us on their own, or they, like you just mentioned, your client, that we have like a grade 3 or grade 4 tear, and I'm like super symptomatic, then they might get referred. But they will come to us later. And now we even have moms who are like, hey, I had my youngest 5 years ago and I'm still leaking. And they're like, finally doing something to kind of resolve it. It's never too late. We have women coming in their late 40s who they're all teenagers for their children. Mm-hmm. There's always, always, always things that we can do to help.
Okay, cool. I love that. So if people are coming in later, and like you said, it could even be years later. So you bring me to a point like leaking's not normal, right? Like a lot of people just consider like, all right, I have had babies, whether I'm in my 20s, 30s, 40s, when I jump on the trampoline, I'm going to leak a little. That's sad. Or when I run or whatever. So tell me about that. Like not normal, right?
Not normal. Yeah, okay. I totally agree. I think our society has put this normalcy on moms to say, oh, I've had babies, so of course I can't run, or of course I have to wear a pad when I exercise. I was just I speak with a newborn, moms of newborns class just about every month with a local group. And I was just there and saying how every time I go to the trampoline place with my kids, there's always all the moms on the side. And they're always like chattering, oh, I wish I could jump with my kids, but I can't. I'm just like, want to shake all the mamas out there and be like, you don't have to
You
live like
can.
this. Any loss of urine, whether it is just a little bit, not requiring pads when you sneeze, or like you're going through multiple panty liners a day, is not normal. And I'm here to tell you that while you're young and near those perinatal birthing years, I promise you, you're going to do better and want to do something about it now versus having to have surgery or having major incontinence when you're in your 5th, 6th, 7th decade of life. So fix it now, ladies. No, it's not normal, and we don't have to accept that.
And you can avoid surgery, right? Like that seems to be a fix. As I'm like with some of my friends who are my age and older, a lot of them are just expecting to get a bladder surgery, and also not needed, right? With preventative care.
Right.
Okay.
Yeah,
Awesome.
exactly.
Awesome. Okay, so if someone does have a pretty significant tearing at delivery, how does I want to guess go down two paths. A very awesome, like very most ideal situation where there's no tearing. What is needed for pelvic floor PT for that person in a quote unquote perfect situation or very ideal? And then on the flip side, when somebody has like a 4th degree separation, what does that look like? Because I don't want people just to say, I have a huge problem, I need help, but what's for the least problematic case, what's good care or standard care? And then, of course, for the challenging cases.
Yes. Yeah. Great question. I'm just going to touch on also a couple of things for the pregnant people listening on preventing peritoneal tears, and then going to go through what you just said, like those two things, because it is common with first-time moms. It is common if we have certain positions or if we have to have an instrument-assisted delivery. But your position and working with a doula, as Angie, I know, chats about on this podcast, can really help with making sure you're in a good position to optimize the ability to stretch that perineum and not have tearing, using warmth. So making sure that we can get in the tub, get in the shower, have somebody apply a warm compress, and just moving and breathing help prevent swelling in the perineum and swelling in our bodies. And that can really aid in the perineum being a lot more pliable and preventing tears. So lots that we can do to help with that. Then I would say for the mom that comes in that doesn't have any tearing, those are the moms that typically will be able to just have those 4 visits. We focus on, do we have a prolapse? Are we still having pelvic floor tension or pain? Because you cannot have tearing, but still have a lot of like tailbone pain, for example, depending on baby's position, or have a prolapse or have a very weak core after delivery. And so there's still lots of things that we would do for that mom in helping her recover physically and get her prepared for whatever activity she wants to return to. Typically with that, we're not going to have as much painful intimacy because there's scar tissue and the tissue healing looks a lot different. So we, again, would be able to have typically a fewer visits as it comes to like physical healing of the perineum.
And I love that you bring up this addresses, even though it's pelvic floor PT, you've talked about tailbone, you've talked about like bony structures, you've talked about, diastasis. So there's a lot of other weak core, a lot of things that extend beyond that, right? That are tied back to the pelvic floor.
Totally.
Cool.
Because, women are given this magic clearance at 6 weeks, which is when they have medical clearance that your C-section scar isn't infected or your cervix is closed, and then birth control, right? We're always asked about, what do you want to do for that?
Right.
That's it. Like, we're not given, you're told to go do everything. And then women are like, great, I can go run, or great, I can go back to my CrossFit class or whatever. And we're like, no, that's not a functional clearance. It's not going to give you any guidance. And most of us, like, if you're not trained in it, like, you don't know what to do and what's safe, and how to really gently return in a sequential and intentional way. And that's really where we come in. So yes.
Awesome.
For the moms who have, so a tear that is in any degree, a grade 1 tear all the way to a grade 4 tear is going to impact the muscles around the vaginal opening and the muscles around the rectum. As we progress through the grade 1, 2, 3, 4, that just is a degree of, pardon my pun on words there, but a degree of severity of how much of that tissue is affected. So with a grade 3 and 4 tear, we see significant tightness and restriction in those muscles. So scars are super strong and tight. They're made of collagen and they do their job really well at helping to keep whatever was open closed. But that also means that it can really impact how well those muscles relax. So vaginally, when we have those muscles being pulled and being tightened because of the perineal scar, penetration is super painful. These are women that have painful intimacy. These are women that are going to have pain inserting a tampon whenever they get their cycles back, or a menstrual cup, whatever we're using. And then the external anal sphincter is a muscle around the rectum. And when that can't fully relax and lengthen, women will have more hemorrhoids, painful bowel movements, tailbone pain, and constipation. And so it doesn't click often for women that it's related. We think of, oh, that's my rectum. This is not related to my vaginal delivery, or, oh, this is my vagina. This is painful sex. It's not related to my, perineum, but they're so related. And so really intentionally treating that scar and doing a lot of manual techniques to get that tissue moving are really, really important. Then we add on normal postpartum hormonal changes. If we're breastfeeding, then we have dryness, then we have the atrophy and all the things that can happen with hormonal changes. Then we have this thick scar. It's an area that really needs to be make sure that we're taking care of, healing well. And so I would say typically with the grade 3 and grade 4, they have more risk of bowel bladder issues, pain issues. That would be someone that would need much more than that, just 3-4 visits. And it totally depends on the mom. If we are like super healthy going in, like you said, had beautiful birth, like we're active, we have good tissue quality, they might not need as much as someone that is post 3rd or 4th baby. And we have like older scars that haven't healed, and we weren't really active during pregnancy because we were high risk, and it's just going to take, that's a different kind of scenario. So I would say it depends on the mom.
Okay. Yeah, the situation. Absolutely.
Right.
So, so someone, if they have never been to pelvic floor PT and they've had a baby and maybe they had some tearing of some kind, it could be a very good idea to come in and address that scar tissue, right? Like help prepare to minimize that for a 2nd or 3rd delivery, wherever they're at, correct?
Yes.
Okay.
Yes. I would say anyone listening, if you have a vulva, you need to go see
It's going to be useful.
Because even if you have no symptoms, I like to kind of use my, if you envision, I had a piece of paper and a big black marker, and I draw a big line, a big horizontal line across that. And that line represented symptoms like pain, leaking, constipation. You might be hovering just below the line. So you have some underlying tightness, you have some underlying stuff, we'll say, going on in your pelvic floor, but it's not quite bad enough to reach that big black line. Well, seeing a provider, seeing a pelvic floor PT or OT will make sure that you are like super below the line where we want to be, so that if you think of down the road, whether that down the road means more babies, whether down the road just means you're approaching menopause, you want to at least know where you are on that spectrum of being close to the line or well below the line.
Knowing that you have some control of where you are, right? Yes, like you can do things.
Yes. Yeah. It is standard of care in so many other countries that women, after you have a baby, is routine. Like you see a pelvic floor PT or OT to just have that for that reason, just to be like, where am I at? How am I doing? You don't have to have this big 4th degree tear and having fecal incontinence to go see a pelvic floor PT. We are here, and we are here to help women, whether you have symptoms or not. And I think that's super important for women to know, because a lot of times they're like, oh, I don't think it's bad enough for me to go see anybody. And I'm like, you're a woman.
Why wait?
Come on, why would you not? Right?
Love that. I love that. So this could be helpful and useful for anyone. And I think that's a big takeaway from this podcast is everyone and anyone can use this wherever they are in the lifespan. So I want to touch on one last thing before we wrap up, because you kind of brought it up and it made me curious. You talked about tissue health. So people have different types of tissue health, right? What impacts, what in a lifestyle or genetics or whatever, tell us what can impact tissue health. What can people do to maximize tissue health? And maybe that's a bigger question for a totally different podcast, but you got me thinking as you talked about that.
Yeah, love that. Yeah, I know that could be a totally like whole second podcast episode. So there's a lot of things that go into how well our tissue heals, how healthy that it is. A few things are just genetics. If we have connective tissue disorders, that would lead us to be hypermobile or have a tension in our connective tissue. And these are things that would have impact like systemically that you would know about, not just the perineal tissue or pelvic tissue. Your age, if you're having a first time baby in your 40s, 50s, or if you are like 18, 19, early 20s, that's our tissue health just is different. Lifestyle factors that help us recover, having adequate, basic things that, we always hear about, but they do make a big difference. Are we chronically fatigued, or do we feel like we get good rest? Do we have enough water in our diet so our tissue is hydrated, or do we drink coffee until 1 o'clock and then maybe switch to wine as soon as it's PM and we never drink water? Are we getting enough protein in the diet? Just when we think about nutritionally, there's a lot that we could touch on from that perspective, but I think just basics of like, are we getting enough fiber? Are we getting enough protein? Are we getting enough water in our diet? And then from a tissue perspective as well, we know that women that are physically active tend to have better recoveries when it comes to birth. And so the national guidelines are 150 minutes of movement a week. And so I tell my patients, think of it like a big bucket that you're just popping minutes in throughout the week. It doesn't have to be like an hour at the gym at a time. But that same guideline goes for pregnancy and postpartum. And so just moving helps with blood supply and blood flow to the pelvis versus, most of us can, especially if your work requires, if you have to sit all day, that's just going to impact that. And so standing, walking, taking breaks, just really, these things seem so basic, and yet many of us are not doing those things on a regular basis to help improve that.
So it sounds like that is definitely something within your visits. As you have a holistic approach, you're talking about those things with your clients.
Yes,
with your patients.
100%.
Okay.
Yeah.
Love
Every
that.
patient that comes in, I use this bar stool analogy of our pelvis is like a little circular bar stool seat, and we got 4 legs that hold it up. And if one of those legs is rocky or short or not working right, you're going to fall off that bar stool.
Tipping out. Yeah.
So sleep, stress, nutrition, and movement. Yeah. Basic things, but they affect so many different systems in our bodies. Mm-hmm.
Cool. Very cool. Thank you for answering that. And maybe we'll chat again in depth about that some other time. Very cool. Awesome. Well, I hope that people have learned a little bit today and gained some awareness of what pelvic floor physical therapy is, the benefits of it. And I love what Dr. Katie said. Anyone with a vulva could use a visit, regardless of your age, where you are in the lifespan, whether you've been pregnant, never have been pregnant, plan to be pregnant, never want to be pregnant. It sounds like it could be helpful for anyone.
Yeah.
Yes, everyone can use this. So Katie, any last words as we wrap up this this portion?
Yeah, thank you so much. I think women I would encourage moms, whether you are thinking about being pregnant, already pregnant, postpartum, wherever you are in your lifespan, just know that you can feel healthy and empowered in your body. And the profession to help you do that most often is a pelvic floor PT, physical therapist, or occupational therapist. Many women get dismissed with their symptoms. Many women feel hopeless in their bodies, and just know that there's so much support out there and resources out there to help you feel empowered and feel healthy in your body, and you don't have to live with the issues that you're having.
Very cool. And I think a lot of times with what we call pregnancy symptoms, which, that can bleed into a lot of parts. We're just like, our providers a lot of times say, yep, that's normal. Yep, that's normal. When we can find some solutions to a lot of those things. So perfect.
Yes.
Cool,
Yes.
cool. Dr. Katie, thanks so much for being with us today. We appreciate your time and your expertise, and hopefully people can make some changes and have an awareness to prepare themselves as best as they can.
Yeah.
So this is Angie Rozier with the Ordinary Doula Podcast. We are so glad you're with us today. Hopefully you do something today that makes you feel happy. Reach out to somebody else and make a connection, and we'll see you next time.
Thank you for listening to the Ordinary Doula Podcast with Angie Rozier, hosted by Birth Learning. Episode credits will be in the show notes. Tune in next time as we continue to explore the many aspects of giving birth.